Señora Hines,
Yes.
¿cómo está? Yo soy el doctor García. Vengo a decirle lo de los exámenes que le hicimos. Hemos hecho un diagnóstico de los exámenes que le hicimos y pues resulta que tiene un problema con el corazón.
No, I don't.
No
No,
entiende.
I don't speak
Bueno,
Spanish.
lo que pasa,
English?
no, mire, lo que pasa es que usted necesita cambiar su estilo de vida
No, I don't
y
understand
necesita
what
tomar
you're
unos
saying.
medicamentos.
No, I only speak English.
Oh,
I
Clarence,
care about my
Clarence,
patient.
How are you?
Fine. I guess you can help me.
Oh yeah, I totally understand what's going on.
Okay.
All right. He's saying your heart is broken. You need to lose some weight. You need to change your diet. And you need to take some mentals.
Sí, son medicamentos, es lo que le
So
está
wait,
diciendo.
he's telling me that my
Mentos.
heart is broken? That makes no sense.
Sí,
I need to
tiene
lose weight
problemas
and I
con
need
el
to eat
corazón.
Mentos?
Necesita tomar medicamentos.
No, can I get
Mentos.
someone else? I'm sorry. I don't
Hi,
understand. It
Good
doesn't make any
afternoon.
sense.
I'm Teresa, I'm your
Oh,
nurse.
somebody, she speaks English.
Oh,
Okay.
Oh,
okay.
gracias,
Hola,
doctor.
Teresa, sí, Mrs. Hines, no se apure, todo va a estar bien.
Yeah.
Mira, aquí le dejo esto.
Okay. I don't understand what he was saying. I think he thinks I'm the wrong patient. I don't speak
Oh,
Spanish.
okay. No problem. We can go ahead and work through this with you. My name is Teresa. I'm your nurse.
Okay.
I'm going to go over your condition with you. I understand that you have been diagnosed with chronic heart failure.
I was.
Yes, I apologize. And it's something that is manageable. It's not anything that you need to be hospitalized for right now, but we're just going to go over a little bit with you and explain the treatment options and different things like that. What do you know about it so far? What do you know about your condition?
Well, I have a family member who actually has the same thing, chronic heart failure. From what I know, it's basically when your heart can't pump efficiently. You have to go through a lot of things just to stay alive. I know that it takes a big toll on African Americans, people that are low income, urban cities that don't have a lot of access to care. Can you tell me more? That's all I know.
You pretty much have you have a good idea of what it is. It is, as I said before, it is manageable, and you do have to make some changes in your lifestyle, some changes in your diet,
Okay.
and we may need to put you on some medications, and that's basically what he was trying to say earlier. I know that you were experiencing some symptoms already. Can you tell me about your symptoms?
I was having a lot of shortness of breath, especially I have stairs in my house, so when I would climb the stairs, it would get to the immediately. At night, I noticed that I was urinating a lot more, and I would always need at least 2 to 3 pillows to sleep comfortably, because if I slept just on one, it was like I would wake up where I couldn't breathe. I was like fighting for air. Also, in my lower and my upper body, I was noticing some swelling. I'm not sure if that's all related to that.
Any weight changes?
Yeah, I have gained some weight.
Okay.
Yes.
Yeah, all of that are symptoms of chronic heart failure. We also did some diagnostic tests, and I'll have somebody go over those with you as well. But as I said before, it's something that is manageable. We want to help you to improve your quality of life, and our goal is to treat the underlying cause. So some of the underlying causes might be that you have a history of higher blood pressure. I know that you had mentioned that you did use tobacco before, but you
Yes.
don't anymore.
Right.
Obesity is a cause
Yes.
also, and as you get older in age, these are some of the things that happen. Some conditions also, I don't know if you've ever experienced cardiomyopathy, hypo or hyperthyroidism, any valve disorders or rheumatic disease.
I do have hypothyroidism.
Hypothyroidism, okay, and then obesity. So those are all things, as I said, we can work on. We're going to treat the contributing factors, and all this can do is maximize your cardiac output, the amount that your heart pumps, improve the function of your ventricles, and we're going to reduce the symptoms, and we're going to try to preserve those target organs. This will improve your mortality, morbidity rate, and as I said, improve your quality of life. Right now, the things that it could complicate in the future would be like your lungs, your kidneys, your heart, your liver. Those would be like pleural effusion, and these are things that you need to know. Just these are the reasons why we need
So
to
I
change your
really need
lifestyle.
to get it under control.
Right, dysrhythmias, hepatomegaly, and renal failure.
Okay.
Okay, so I'm going to go over a couple of things, again, that we want to avoid. Oxygen therapy is one way that we treat it. You're not that at that point yet, but you would use a mask or you would use like a nasal cannula, and then mechanical options. And again, those are way in the future, but it's something that you should keep in mind, like a pacemaker, a defibrillator. And then finally, physical activity. We're going to get you in a cardiac rehabilitation program so that we can improve your lung function and show you some tricks on how to rest and conserve energy.
Also, with some help, I can exercise.
Right,
this way.
definitely. You just have to do things a little bit differently, and it's best that you do it with some type of provider helping you out in a plan. We need a plan.
Okay.
So Lauren is going to come in here, and she's our nutritionalist, and she's also the case manager that's handling your case, and she's going to go over some of those options with you and just things like that. Did you have any questions for me right now?
No, I mean, you're saying that it's manageable, so I think I'm okay.
Okay, good. All right, I'm going to let Lauren talk to you.
Okay. Well, thank you so much.
Thank you so much. And we'll be back a little bit later, okay?
Okay, thank you.
Good afternoon, fans. I'm Lauren. I'm going to be the dietitian to help you with everything, okay?
Okay.
All right. So, nutritional-wise, are you familiar with any of the nutritions for?
No, I've heard of some things, maybe where you want to modify your diet. I'm not sure exactly how to do it, but I can tell you that I love fried food. I love salt, and I'm a very heavy seasoner. My husband always says that.
Okay, so with that, we're going to want to kind of avoid all this now, okay? The DASH diet, which is dietary approaches to stop hypertension, which is what's usually causing the chronic heart failure, is something that we want to keep a hold of, all right? With that, you want to kind of stay away from the seasonings, salts, even the table salt. I know it's hard, especially in today's world, where we're just quick to season everything now. Okay, also stay away from the canned goods, your canned veggies, your canned soups. I understand it's easy.
You can't have those either.
No, the preservatives that are in it are very, very high in sodium.
Okay.
Also some of your vegetables, like your carrots and your celery, are very high in sodium as well. So just limit them, all right, with that, and then also with your milk products. Okay. And then eating out, like I said earlier, I understand that with today's world, we're always on the go. With that, when you're eating out, try and do a low sodium menu, or even ask them how they make it. Okay, if you see something that's pickled, something cured, those words there is when it's going to start kind of cueing you in on that. It's kind of worrisome. And then your fluid restrictions, this can be challenging. Okay, since the families or the medications that we use are very causing thirst, I guess you would say.
Right.
Hard candy, ice chips, something of that nature to kind of help you with the thirst. Okay. Also, daily weights these are important.
Okay, the daily weight. So am I just weighing myself whenever I want, or?
No, you want to do it more in a routine. So my best suggestion would be in the morning. Okay. So you can keep this routine. Same clothing, same time to keep it going. Okay. And just make sure you make a log of this as well. Okay. And then your signs and symptoms of fluid retention. Are you aware of these?
Yeah, I was telling the nurse that was in here before you that I was having some swelling in my hands and my feet. I'm not sure why that's happening.
Okay, this is happening because of the fluid overload in your body. Okay, so with that, just make sure you're recognizing this. If it's getting to the point where you're actually what they call pitting, to where it's taking a really long time or quite a while for that skin to bounce back, definitely call your healthcare provider, okay, because something else is going on. We can put you on medications for that as well. Okay. And then prevention for some of this stuff is get your annual flu vaccine, okay, as well as your pneumonia vaccine. Okay, that's every 5 years of pneumonia, and then the flu is every year. Then also develop a plan to reduce your risk factors, all right? And exercising, we're going to talk about some of your exercising. We want you to exercise. Okay. Walks start off slow. You start feeling short of breath is when you kind of want to slow it down a little, okay? And do you have any, I understand that this is really overwhelming.
Yeah, this is, and I'm sitting here as you're talking thinking, how am I going to afford all this stuff, the medications? I mean, I work. I don't even know where to begin to put all this now into my life. It's like everything is going to change now.
Okay. With this disease, I mean, it's all manageable, okay? It's we can keep it under control. There's going to be some anxiety and some depression that comes along because you're trying to manage everything. It's new. We understand that. But with that, once everything becomes asymptomatic and you kind of have everything at base, you should be okay. Okay. But we'll have Clarence come in and talk to you about your medications, what to expect, and how to go from there.
Okay.
Okay. So everything's good.
Okay.
Okay.
So we'll come up with a plan.
Yes, ma'am.
Okay.
All right.
Thank you so much.
Yes, ma'am.
Hello.
Morning, Miss Haynes. My name is Clarence. I'm your pharmacist.
Okay.
Okay, I'm just here to talk to you about your medications, okay, and some of the diagnosis tests they did on you earlier. So first of all, we're going to go ahead and talk about diagnosis tests that they did. Okay, they did a history and physical on you, okay, just by collecting information from you, and they also did a chest X-ray which just shows your heart size, okay. That's all it does. And they also did a 12-lead EKG on you.
Oh, that was where they stuck the things on, right?
Yes, they stuck the leads in.
Okay.
And all it just does is tell us exactly how your heart is functioning, if it has different rhythms, okay?
Okay.
All right. So, little about your medications, okay? Your doctors may order a few different meds, okay? One of those could be a diuretic, okay? Another could be ACE inhibitor. Some of those could also be vasodilators, okay, and adrenergic blockers, okay. What does the diuretic make you pee, okay, and the ACE inhibitor is also going to lower your blood pressure as well too, okay. So a lot of these different meds, what you want to watch out for is that it's going to drop your blood pressure, okay. It's going to make your blood pressure real low. So when you're waking up out of bed, you want to go ahead and wake up very slowly, okay. All right. And the main goal for we want to see is that your blood pressure has dropped, okay, to a manageable number, okay. One thing we're also going to teach you is how to take your blood pressure, okay. At the same time, how to take your pulse, okay. If your pulse is below 50, okay, you don't want to go ahead and you do not want to take the ACE inhibitor or the beta block, okay. And if your blood pressure is below or at least at 100 over 50, you don't want to take your diuretics as well either, neither the ACE inhibitors, okay? Because like I said earlier, it has the potential to drop your blood pressure, okay?
So with a lot of those medications, since they're helping me manage it, I just have to make sure that, like you said, I check my pulse, blood pressure, and wake up slowly so that I don't get too dizzy or hurt myself. Okay.
And I know this is a lot of information, sorry to interrupt, but we are going to get you a home health nurse that will come in a couple of days a week to teach you how to do this and to help you get it to a point where it is manageable. Okay.
And
also, I know that you had said something about finances. We have
that's a big concern.
Okay, well, we'll go over your insurance and see what you qualify for, see what's available at your job.
Okay.
And a lot of these drugs are generic, so they will be less expensive than what they used to be.
Okay.
Okay, and they have talked to you about what chronic heart failure is, right? Okay, so pretty much it's just over a long period of time, there are some conditions that can, affect your heart, okay, such as high blood pressure, hypertension, okay, or you may have like coronary artery disease or your diabetes also, okay. Those can all affect your heart over a long period of time. The longer it goes unmanaged, okay, that's when your heart starts to fail.